Hey there, and welcome to another lecture from CyberMD. Today's lecture will be over left and right bundle branch blocks. Please be sure to like, comment, and subscribe to our content so that we can continue to provide a free medical education to students around the world. This is a critical topic for those of you who are studying for the USMLE STEP 1 exam, as it will come up in the cardiovascular section. Let's begin with a comprehensive definition of what a bundle branch block is. A bundle branch block is a type of heart block that affects the electrical signals that control the heart's rhythm. There are two main types of bundle branch blocks: left bundle branch blocks and right bundle branch blocks. These two types of blockages can occur in different parts of the electrical conduction system of the heart and can cause different symptoms and outcomes. Now, let's discuss the etiology of bundle branch blocks. The cause of these blocks can be due to various factors such as age, heart disease, heart attacks, heart valve disease, and certain medications. Left bundle branch block is more commonly seen in older individuals and those with heart disease, while right bundle branch block is more commonly seen in younger individuals with normal hearts. However, it is important to note that bundle branch blocks can occur in anyone, regardless of age or health status. Despite these things, the primary etiology of bundle branch blocks is stretching of the myocardium, as is seen in dilated cardiomyopathies. Again, the primary etiology of bundle branch blocks is stretching of the myocardium, which is seen in dilated cardiomyopathies. Significantly less than 1% of the general population has bundle branch blocks, but the prevalence increases with age. Let's delve into the pathophysiology of bundle branch blocks. In a healthy heart, electrical signals travel from the sinus node through the atria, then down the bundle of His and into the ventricles. When a bundle branch block occurs, the electrical signal is slowed down or blocked in either the left or right bundle branch, causing a delay or complete blockage of electrical impulses. This can lead to a prolonged or widened QRS complex on an EKG, which is the hallmark of a bundle branch block. A prolonged QRS complex can result in a decreased contractility of the ventricles, leading to symptoms such as fatigue, shortness of breath, chest pain, and lightheadedness. Now, the history, physical, and evaluation of a bundle branch block. Both left and right bundle branch blocks are typically asymptomatic and are usually only incidental findings. Let's discuss the appearance of bundle branch blocks on an EKG. In an EKG with a left bundle branch block, the QRS complex is usually wider than 0.12 seconds, and the terminal QRS deflection is usually in the direction opposite that of a normal EKG. It is easiest to simply check lead V1. In an EKG with a right bundle branch block, the QRS complex is usually wider than 0.12 seconds, and the terminal QRS deflection is usually in the same direction as that of a normal EKG. It is important to note that these are general rules and there are some exceptions. For clarification, an upward or widened deflection in V1 would indicate a right bundle branch block, while a downward deflection of a widened QRS would represent a left bundle branch block. Some people remember this using the turn signal method, where if you were to put on your blinker in your car to turn right, you would move up on the stick to the left of your steering column. Therefore, in V1, an upward deflection with a widened QRS may represent a right bundle branch block as you are moving up on the joystick next to your steering column and you are turning right. And the same can be said for a left. If you push down on the joystick and you have a downward deflection in QRS in lead V1 and a widened QRS in lead V1, then you may be looking at a left bundle branch block. Now, let's move on to the treatment and management of bundle branch blocks. In most cases, bundle branch blocks do not require treatment. However, if a bundle branch block is symptomatic or if there is an underlying heart disease present, treatment may be necessary. Resynchronization therapy may be such a treatment option. It's also important to consider the differential diagnosis of bundle branch blocks. Other conditions that can cause a prolonged QRS complex on an EKG include ventricular tachycardia, ventricular fibrillation, Brugada syndrome, premature ventricular contractions or PVCs. These conditions should be ruled out before making a diagnosis of a bundle branch block. Finally, let's discuss the prognosis and complications of bundle branch blocks. In most cases, bundle branch blocks are benign and do not cause significant health problems. The prognosis, therefore, is very good, but is dependent upon whether or not underlying disease is present. Patients with significant cardiovascular disease and a right bundle branch block may experience higher mortality rates from cardiac issues. In conclusion, left and right bundle branch blocks are important topics to understand for those studying for the USMLE STEP 1 exam. A thorough understanding of the pathophysiology, the appearance on EKG, as well as the differential diagnosis is essential for success on the exam and in clinical practice. Again, thank you for tuning in, and we hope this really helped.